Hello to everyone. Thank you for being here. Thank you to France Parkinson for this invitation. And together we're going to tackle a totally different topic from what we've heard so far. We're going to be talking about the Lady PD study, which was specifically developed in order to study the fluctuations, um, hormonal fluctuations in Lady PD patients. We know that each patient is different, but there are also differences between men and women. We know that this disease is more frequent in men, and there are also clinical differences. We know, for instance, that women have a tremor component, which is more developed than for men. They suffer more from dyskinesia and so on. So there are important differences between men and women, and we need to keep those in mind when we're talking about clinical studies in order to adapt the care and treatment. This is called precision medicine in order to finally target the care of a given patient, taking into account the differences between men and women. Now, the main promoter and the main investigator was Professor Elena Moro from Grenoble. And through this study, we're able to enable women to better identify and manage hormonal factors which can trigger the disease, or the symptoms rather. Why did we think about this? Well, because there are interesting differences, and we've seen that a certain percentage of women show an increase in the symptoms during the week before and during their period, with an improvement after their usual symptoms come back. Now, this topic is not well known, a bit underestimated, but it's important because it has an impact for these women professionally, personally, in their everyday lives. And it's also important because 20% of women suffering from Parkinson's disease are less than 60 years old, so potentially impacted by this increase in symptoms during their period. Right now, we lack data on the effect of hormonal fluctuations and its effect on women's everyday lives. We don't have official recommendations regarding how to adjust the treatments either. And that's why we decided to carry out this study.
The idea is that the menstruation interfere with the motor and non-motor symptoms in PD. This is a multicentric study. 4 centers are participating in the research. There is Toulouse, Nantes, Rennes, Grenoble. And we are going to enroll 100 female subjects suffering from Parkinson's disease. The trial is a pilot trial, which means it's the first time that a trial is looking into this specific subject, and it could open the way for more studies in the future. The main goal is what we're really looking for is to document changes in Parkinson's disease symptoms during the menstrual cycle, thanks to a digital application called My Moves Matter, and what's specifically developed for the trial by a woman who suffers from Parkinson's disease. And she collaborated with the France Parkinson Association, so she's really obviously familiar with the matter. And we're going to look into the changes that happen with this application. But there are other endpoints, secondary endpoints in the study. We compare the collected motor data that we collected with the mobile application to obtain some objective data collected during the clinical examination, the neurological examination, and we also collect data thanks to with the help of a device called PD monitor. It's a connected watch which can be worn by the patient, and it collects data regarding abnormal involuntary movements, dyskinesia, and other such data, and it provides a collection of motor data that can be compared with the other information. Finally, we determine whether a change in the treatment introduced by the neurologist is or is not efficient. Once we have all the data in the application, we value whether the change in therapy has any benefits. We can also assess whether there are differences between women depending on whether they are on any birth control therapy, whether this makes a difference regarding motor symptoms. We want to understand also whether the digital application is easy to use, very user-friendly and convenient or not. So who can participate in the trial? We're looking at women between the ages of 18 and 56 who should not be menopausal and diagnosed with Parkinson's disease according to the official criteria, and who have been suffering from the disease for at least 2 years before they are enrolled in the study. And these subjects should be on a stable medication for at least 2 months, and for whom we do not plan to change the medication for the next 3 months. The subject can also be on birth control therapy, such as pill, birth control pill, or an intrauterine device. There are some contraindications, criteria for non-inclusion, for instance, women who are in the perimenopausal period, or any condition which, according to the investigator, could prevent the study from being successful, prevent the subject from participating in the study appropriately, such as advanced cognitive disorders or severe depression, or people who are incapable of using the digital application for many reasons, for any reason. Practically speaking, what do? We start by enrolling the patients in all 4 centers. All 4 centers are specialized centers for Parkinson's disease. The patients are seen in day hospital or during hospitalization by the neurologist, who may ask them whether they want to participate in the study. Then there will be a specific appointment with an interview. We check all the inclusion criteria. We also perform a neurologic examination with a motor scale and other questionnaires regarding quality of life. And we also put the app in the patient's smartphone and explain to the patient how to record the data and enter the data in the smartphone application. The patient will go home with the application, knowing how to enter the data regarding motor symptoms and also the menstrual cycle during the whole duration of the study. And the study is meant to last for 6 months. After 3 months, there will be a video appointment with the patient, just to check that the patient has been able to use the application appropriately and that all the data has been recorded, and we directly have access to the data collected by the application. The neurologist can see the data and possibly adapt the therapy depending on the motor fluctuations entered by the patient. Say, for instance, the patient found that 4 days before the menstrual period, the motor symptoms worsened. Then in that case, the doctor can suggest to increase the treatment in the days before the menstrual period. And this is the appointment at the end of the study. Very simple. Clinical assessments, motor scale, questionnaires on quality of life. And also we perform a few scale interviews regarding whether the application was easy to use and whether the patient feels that it worked well. Now, this new application can be used on Apple and Android smartphones, basically on all smartphones. There are several thumbnails, and with those thumbnails, the patient can enter motor and non-motor symptoms. The patient can enter the type of symptom, but also the severity of the symptoms. And we can also follow the menstrual status on the day of the menstruation, the duration of the menstruation, whether there is a change in the symptoms before and during the menstruation. The patient can also write in the agenda a detailed account of all the symptoms that she may have observed so that we have additional information and more accurate information. There's also a specific thumbnail for therapy, medication. And depending on how and when she was taking her medication, what fluctuations were observed regarding the motor symptoms. Finally, there is a small subgroup of female patients, female subjects, 10 patients, in whom we observed changes in the symptoms during menstruation and who were included by the Grenoble Center, and they received a PD monitor. The PD monitor is a connected monitoring device which has already been tested, and we want to perform a sort of sub-trial, a subgroup trial with the PD monitor so that we have even more accurate motor data to be combined with the other data collected. This is the team in Grenoble who has been working on this trial. And I would also like to thank all my colleagues from the other centers, Nantes, Rennes, and Toulouse, who participated actively in the trial. All the centers have already started enrolling patients. We started early this year in 2025. We need you. We need your support if you would like to participate in the clinical trial, because without you, we're not going anywhere. Thank you very much for your attention. Thank you. Before we move to the Q&A session with the audience and the people who are following us online, we're going to do the last poll. So question, please. Did you listen? What digital tool is used in the Lady PD study? My Moves Matter, Parkinson Go, Parkinson app, and Move My Body. Again, apparently everybody has been listening, and you may download the application if you're interested. You can also talk about the development of the application if anyone is interested in the audience. Now, the next question is more a yes and no question. We'll see whether yes or no prevails. Did you know before you came here today that hormonal fluctuations could influence Parkinson's disease symptoms? And that's why these studies are so important, because they make us realize that women are not sufficiently taken in consideration in the studies. In the dosing regimen, for instance, women are not men, so the dosing regimen should be to take in consideration the fact that a woman is a female patient. So no prevails. So My Moves Matter. That's the name of the app, and women are not men.